This is Adam Rosh from Roshcast, and I want to welcome you to another episode of The Reveal, where I will take you inside the mind of a test taker to deconstruct and connect the dots of a board-style question so you can become a better student, transform how you learn, and excel not only on high-stakes exams, but also in your general medical knowledge. So let's get started. We have a 39-year-old man who presents to the emergency department with left hand pain. He denies recent trauma, genital or oral lesions, or fever. His medical history is significant for diabetes mellitus and tobacco abuse. His examination is shown above. Which of the following is the most appropriate initial therapy for this patient? All right, this is a second order question. We first have to identify the condition through the history and this wonderful image that we see up here on the question, and then decide on what is the initial therapy that this patient should receive. So a couple hints here. They talk about oral and genital lesions. Well, why would they want to do that? Because looking at this finger, this certainly has the appearance possibly of a herpetic whitlow. Herpetic whitlow is due to an infection by herpes simplex virus. So they're leading us to believe that this patient doesn't have lesions anywhere else, although you can get a herpetic whitlow most commonly from someone else, maybe as classically dentists or dental hygienists would get them on their fingers. But in this case, where they're telling us that there are no oral or genital lesions. Okay, fine. So he also, this patient has a history of diabetes, so comorbidity, and tobacco use, so prone to infection, so probably slightly immunocompromised here. All right, so let's look at our answer choices and see if we could identify which one is the best answer for the initial therapy. Let's start with Acyclovir. Acyclovir is going to treat herpes simplex virus, but we talked about why it's unlikely to be herpes simplex virus given the history in the question. And also herpes simplex virus, you're going to see vesicular lesions classically. You know, they may ulcerate, and you could see on the tip of the finger here, there may be some ulcer forming, but classic whitlow is going to show vesicles or large or ulcer, clear ulceration. So in this case, we do not see that. So I'm going to cross off Acyclovir. Next, let's go to answer choice B, Clindamycin IV. Well, Clindamycin IV is going to treat certainly strep, staph, bacteria. This patient, if we believe that this is an infectious process, may need antibiotics. So let's hold on to that and go on to the next one. And we have left C and D. I'm going to go to D first. D is trephination. Trephination is used less and less these days. And most commonly in the emergency room, we will see this for subungual hematomas, typically when there is blood underneath the nail. You will have, if there's 100% coverage of blood, trephination may be recommended in those cases. There's some really literature is going back and forth with it. But in this case, there's no role for trephination here. So I am going to cross off trephination. So we're left with antibiotics or incision and drainage. Now, let's look at what they're really asking us. The most appropriate initial therapy. Well, this patient appears to have an abscess in the distal finger, but abscesses in the fingers are a little more complicated than ones that may occur, let's say, on your arm or forearm. It has to do with the anatomy of the finger. And so this is what you would call a felon, right? This is a pyogenic infection of the subcutaneous tissue and the pulp of the distal finger. Because of this tight space, this infection could lead to osteomyelitis. It could lead to a worsening infection. And so we definitely want to address this immediately. And therefore, incision and drainage is what I'm thinking is the correct answer choice. So let's cross off clindamycin, and the initial choice should be incision and drainage, and maybe this patient would get clindamycin subsequently, but the prime therapy should be incision and drainage. So let's see what we get here. Sure enough, this patient has a felon, and incision and drainage is the correct answer. Hey everyone, before you go, if you're interested in your own QBank, whether you are an MD or DO, a PA, or an MP, simply go to roshreview.com and sign up for a free trial. See if Rosh Review's content is right for you. Keep learning, keep working hard, and always have a sense of mission about your work. Now is your time. This is Dr. Adam Rosh, signing off.